Without objection.
Mr. Speaker, over 14 years in private practice in medicine, I had the great privilege to treat many, many Medicare patients, thousands of Medicare patients. I did open heart surgery, complex open heart surgery, lung cancer surgery, in times of great need, great difficulty for these seniors who had paid many years of their payroll taxes into the Medicare program with the hope and the recognition that this program would be there for them, for their health care needs in their later years. And I'll tell you, in the 90s, when I was amidst the peak of my practice, it was not unusual. In fact, quite often, patients would come into the emergency room with a very difficult situation without a primary care physician because they had not had previous health problems. And then what would happen is we would have to do emergency heart surgery on them. And once they got through all of this and got through the hospital stay, we could not find a primary care physician to take them on, to treat their everyday problems with hypertension, high blood pressure, diabetes, gout, and things of that nature. And I would get on a phone time and time again, and I would call family doctors and internal medicine physicians and plead with them, why can't you take this one more patient into your practice? And it's because the reimbursement situation for Medicare was so bad, even back then in the 90s, that if a physician took on too many Medicare patients, they couldn't meet their cost. And that situation's gotten much worse today in 2011. I can tell you that I have grave concerns about the future of the Medicare program and what's going to happen. And I'm not speaking as a member of Congress, I'm speaking as a physician, as somebody who cared for many, many patients, who valued that doctor-patient relationship. This situation whereby families who have a loved one on Medicare cannot find a primary care doctor, this is a very serious situation today and getting worse by the week. The bottom line is Medicare is in trouble. I saw this as a doctor and I see it now as a member of Congress. Just a couple of facts. Over 10,000 baby boomers are reaching retirement age every day, leaving fewer workers to support them. We have an aging population. And this is putting tremendous cost pressure on this Medicare program. In fact, the Medicare program, according to the Medicare actuaries, the trust fund that provides the money for the hospital program is going to be out of money 2024. And in fact, starting last year, more money was being paid out than taken in to support this program. And in fact, the Medicare actuary predicts that without changes to the current law, something that was basically not looked at when the health care law was passed, in fact, it was assumed that these certain cuts to physicians would occur in the law. In fact, what we know is that without any changes to the law, physician reimbursements will fall from 80% of private rates to 57% of private rates in 2012. Now, what does that mean? That means that the situation for physician practices will get even worse, whereby they can't even meet the cost of their practice. And therefore, they're going to continue to limit their exposure to taking on new Medicare patients. That means access problems. That means Medicare patients cannot get access to physicians. We need real solutions to this. We need fact-based solutions. We need answers to the problem and not political rhetoric. And so far, that's all we've seen, largely coming from the other side and from the White House on this. In fact, we're on a path to see the bankruptcy of this Medicare program if we don't act. Now, let's take a step back and look at what happened in the health care bill. This health care bill, which passed without Republican support, cut over $500 billion from this Medicare program to expand coverage into a new entitlement, an extension of the Medicaid program. We're digging a deeper hole for ourselves without a way to pay for this. And now the plan calls for an immediate 17% cuts in benefits for our current seniors, not people who are going to go on to Medicare in the future, seniors who depend on this important program today. Another thing that's in this bill, and it's not well known, is a new bureaucratic entity that was created. There were many that were created in the health care bill, but that really bothers me as a physician. It's called the Independent Payment Advisory Board. Okay, sounds kind of innocuous. Well, what does it do? It's a 15-person board arbitrarily chosen that will make life and death decisions about what things will be paid for under the Medicare program. Now, what is the recourse in all this? This is an arbitrary decision-making body, and you cannot dispute what this body is going to do. In fact, for Congress to override it, it would take 3/5 of the Senate to override it. This is going to damage the doctor-patient relationship. It's bad for Medicare patients. And I can tell you, Republicans have an idea about how we're going to fix this. I can't get into it now, and I'll do it in a subsequent speech. I yield back.
The gentleman's time has expired. The chair recognizes